Hello, my name is Sophia Fitzgerald. I'm a third-year pharmacy student at UNC, currently on rotation at the Cone Health Family Medicine Center. Today, I'll be going over the latest pharmacy news for the month of October. For this month's news, we will discuss the recent approvals of Exxua for major depressive disorder, Velsipity for ulcerative colitis, and an approval for Penbraia, a new pentavalent meningococcal vaccine. We will also discuss North Carolina's upcoming Medicaid expansion. The first approval we will discuss is the use of Exxua in patients with major depressive disorder. Exxua was approved as a novel treatment for use in major depressive disorder. It is a 5-HT1A selective receptor agonist. Its dosing is 18.2 mg daily and can be up-titrated to a maximum dose of 72.6 mg daily. Like many antidepressants, Exxua has a black box warning for suicidal thoughts and behaviors. Additionally, it should not be used in patients with a QTc greater than 450 milliseconds. Exxua is the first of its class to be approved for major depressive disorder, and its place in therapy is still to be determined. Additional research is currently in progress regarding its use in generalized anxiety disorder, as well as hypoactive sexual desire disorder. The next approval we will discuss is the use of Velsipity in moderately to severely active ulcerative colitis. Velsipity was approved on October 10th and is the second medication of its class, sphingosine-1 phosphate receptor modulators, to be approved for use in ulcerative colitis. Prior to the initiation of Velsipity, the following evaluations must be completed to ensure the patient is eligible for treatment. Of note, patients with cardiac history may not be candidates for Velsipity due to the cardiovascular risk associated with the medication, as you can see in both the contraindications and warnings. Aside from cardiac risk, there are several other warnings to be aware of as well, as seen here. Current treatments for ulcerative colitis include biologics, one other S1P receptor modulator, ozanimod, which was approved for ulcerative colitis in 2021, and glucocorticoids. The ultimate goal of these therapies is for patients to achieve remission. Velsipity is expected to be available in November and can help patients reach remission, including patients who had previously failed or were intolerant to other ulcerative colitis treatments. In patients who had prior therapy, 21% of patients in the Velsipity group achieved remission, compared to only 5% of patients in the placebo group. Finally, the last approval we will discuss today is Penbraia, the pentavalent meningococcal vaccine. Currently, we have meningococcal vaccines that cover serogroups A, C, W, and Y, and vaccines that cover serogroup B. And as you can see here, the current vaccination schedule requires at least 4 vaccinations to cover all serogroups. Penbraia covers all 5 serogroups, A, B, C, W, and Y, in one vaccine, administered as a 2-dose series. When compared to Trumemba plus Menveo, the clinical trial found that Penbraia was non-inferior in seroresponses in serogroups A, C, W, and Y, and actually displayed superior effectiveness in 3 of the 4 serogroups. The study also found that Penbraia was non-inferior in seroresponses when looking at serogroup B variants, and displayed superior effectiveness in 2 of the 4 variants and in the composite. Ultimately, Penbraia demonstrated non-inferiority to Menveo plus Trumemba in seroresponse rates to all serogroups. Currently, there's no information on when Penbraia will become available, but when it does, it has the potential to simplify the vaccination schedule for meningitis. Penbraia was found to be safe and effective for meningococcal protection of serogroups A, B, C, W, and Y. Finally, we will cover the upcoming changes to North Carolina State Medicaid. Patients ages 19 to 64 with an income of up to 138% of the federal poverty level will be eligible for Medicaid starting December 1, 2023. Patients who already have family planning Medicaid and will become eligible will be automatically enrolled on December 1st. Of note, there is still a gap for patients between 138% to 195% of the federal poverty level who will still only be eligible for family planning Medicaid. Patients can be directed to these resources in order to apply. The easiest option for most patients will be to complete the ePass online, but there are alternative options to apply listed here as well for patients with limited access to electronics or the internet. In summary, Medicaid expansion will go into effect starting on December 1st, and patients can be directed to ePass or the local DHHS office to apply. Those with family planning Medicaid will be automatically enrolled if eligible. Additional information can be found at the website shown on the slide. And here is a recap of everything that we discussed today for the updates this month. Special thanks to Dr. Pete Koval, Anna Becker, and Gina Upchurch for contributions to this month's updates.